Okay, so what are we talking about? We're talking about today. We're talking about spasmodic torticollis. Okay, now, so there's different types of torticollis, and what torticollis does basically is it inhibits the movement of the head or painful movement of the head. Okay, now with spasmodic torticollis, basically the SCM muscle is the one that's locked down, and it'll lock you down into a lateral position, lateral flexion. Okay, so you kind of lock there. This muscle will not release. So this muscle here is in spasm. So what do you got to do? Okay, so when you have a tight muscle that will not let joints, now this is multiple joints over the large segment of cervicals, right? Will not move, you're going to have subluxations throughout that cervical spine. And subluxations, as you know, is what we adjust. So not only that, but now you got a soft tissue element where the muscle will not release. So we have to do some PT, some soft tissue work in adjusting. Depending upon the severity is how long it's going to last. There's also other types of torticollis. What I clinically find a lot of is side sleepers get torticollis, the inability to rotate one's head, either to one side or both sides. And that's a lockdown of another muscle called the levator, right here, the levator scapulae. And what happens is that one gets tight. And since the levator muscle's function actually is to assist in raising up of the shoulder blade, but when it's in spasm, it's involved in every head position and movement. So when it's in spasm, you can't rotate it. So I've had patients come in here crying because actually I had one time crying. She swore she broke her neck during her sleep. And it took me a while to convince her, you didn't fracture your neck. It's just this muscle's locking you down. And that's why it's painful to even hold your head up. But the treatment is actually simple. It depends on the severity. It can be pretty severe, painful, to just a mild inconvenience for a while. But treatment's pretty simple, adjusting different soft tissue techniques, some stretching, uh, and the patient, depending upon severity, should be pretty good. And actually functional, pretty functional, almost 100% in a couple days. So that is that spasmodic torticollis.